Next speaker we have Dr. DOEL BISWAS, I suppose. Yeah. So can we have the introductions? And
Yes, Dr. Deval is a senior consultant at Shushruth Eye Foundation and Research Center, Kolkata. She is a cataract and refractive surgeon, and she would be talking on. Give the topic, please.
Yeah, I'll just. The topic is why I like to be associated with the NGO hospital. Plenty of surgical exposure and work satisfaction. By Dr. DOEL BISWAS. Over to Dr. DOEL BISWAS.
Yeah, she is preparing.
When I got this topic to speak on, I felt so old and wise. However, listening to the speakers before me, now I feel like the poor cousin in the family wedding. All those private practice and lakhs that they were talking about. However, I will try to convince at least one or two of the younger generation that they should join a trust hospital, at least in the first half of their career. Now, instead of talking about how a trust hospital is good for you and all that, I'm going to hold up a model for you. The hospital where I work, this is an NGO hospital or a trust hospital, Shushruth Eye Foundation and Research Center. It is located in Calcutta. And when I joined this place about 12 years ago, it had only one building and one branch at Berhampur. We now have three buildings actually, and we have the various branches which have opened up at various places, and more branches are opening up. We also started off when I joined with just 15 doctors. They were all senior consultants. Now we have around 45 doctors, which also includes junior consultants. Of course, besides this, we also have a lot of trainees. So, Shushruth Eye Foundation, along with another hospital of a similar model called Disha in Calcutta, it would be fair to say that we cover almost the entire, 80 to 90% of the population of Calcutta and the surrounding areas who fall in the lower income and mid-income group. So we don't have a lot of celebrities walking into our OPD every day, but yes, we do have a lot of patients. That's because we usually provide free or a much subsidized service to the patient. And we have various organizations which fund us. Obviously, we can't provide subsidized service and give a decent salary to the doctors and staff. So we have a lot of organizations, NGOs funding us, and these are some of the NGOs which are actually funding us and thus diverting their funds, and we do the work, they provide us with the funds. All the work is not necessarily free, but a lot of it is subsidized. What are some of the projects that we are involved in? One is outreach activities where we go outside the hospital. Pediatric camps which are done within the hospitals, these are totally free. And how does this help young ophthalmologists joining the hospital? Obviously, if you are interested in doing a pediatric fellowship, or if you've just done a pediatric fellowship, you get a lot of exposure, because from these camps we pick up a lot of pediatric cases for squint surgeries and for other surgeries. Diabetic retinopathy screening camps are regularly held, usually on Sundays in the hospital and also outside at outreach sites. Besides this, awareness campaigning, Vision Center, Vision Van, not directly related to ophthalmologists, but these are the channels that bring in the patients. These vision centers that are located in the periphery, in the rural areas, vision vans that visit all over. And the vision van actually started during the COVID time when people could not come to the hospital. And now we find that with continuation of this, our footfall in the hospital has really increased, because these are the services that bring in the patient to the main center in Calcutta. Activity over the last 5 years, I'm just trying to show you the growth pattern that has taken place. Now here, concentrate on the OPD number, not so much the IPD number. The OPD patients that are coming in, the numbers that you've seen, these patients are all patients who are given service at a very, very subsidized rate. And you sort of do a registration and you are provided with all the services. Now, how does that help an ophthalmologist, a young ophthalmologist? Look at the number of patients that you are exposed to. On a regular basis, a young ophthalmologist in our hospital on a bad day sees around 50 patients, and somewhere on a good day sees around 90 patients. And a senior ophthalmologist, on an average day, I see 50 patients, and it goes up sometimes even to 100 a day. And now I'm mostly seeing appointment patients since I've become a senior consultant, and my appointments a day are almost like 70 to 80 patients a day. So you are being exposed to this number of patients and a wide, a varied section. It's when you are sitting in the OPD, before you actually divert the patient to a specialist, you get to see the patient. So even if you're sitting in an OPD and an patient without an appointment comes in, it may be a corneal ulcer. So you are exposed to a corneal ulcer before you total cases that have been supported, these are the total number of cases that we have performed surgeries on. So this is, when I'm talking about surgeries, these are the cases where we have done free surgeries or subsidized surgeries. I'm not talking about the ones who come in paid. These are the cases where we are doing free surgeries. And a trainee today is getting an exposure of 1 to 2 cases depending upon the skill and per day, and a junior consultant gets about 10 cases per day. Of course, that's on rotation basis depending on how many junior consultants we have, and the rest of the cases that are there is done by the senior consultant. The senior consultant also does a lot of free and subsidized cases. When I started off in this hospital, I was doing what we used to call camp surgeries, around 50 to 20 a day. These are some of the training facilities we have in our hospital, and these are the number of people who have been trained in our hospital over the years, last 5 years. Work satisfaction. Now, when I was making this slide, the head of the institution, Dr. R.C. Paul, was sitting by me, and he was doing his own work. And when I told my people, I said, show a bit of the packed OPDs and all, he started laughing. He said, that gives work satisfaction. He thought I was just trying to, because he was nearby, I was putting up this slide. But that is not the case. See, work satisfaction, again, varies from person to person. It depends on your perspective. At the end of a OPD, you can be very, very tired. That tiredness is of 2 types. You can be very, very tired because you have seen around 80 to 90 patients. Every fiber in your body is hurting. You just want to go back to bed and curl up there in a corner, but believe me, your mind and your soul is so satisfied. You are contented, your body is tired. There is another type of tiredness which once in a while we face in our OPDs on when there are buns and when there is a bad weather, where you have been sitting in the OPD from 8 to 5 in the evening, no patients, and at the end of the day you are very, very tired, your body is tired and your mind is tired. So that is another type of tiredness you have. Again, job satisfaction depends on the sort of lot on your own personality. I always feel there is always a practice personality. The people who are charming, who can sugarcoat their thing, who have a lot of patience to listen for 45 minutes to a person describing how his eyes itch and pain and water. And you have the other type of personality. So that is work satisfaction for you. Thank you so much.